Something went wrong, please try again later. An internal critical incident has been declared at Blackpool Teaching Hospital's NHS Foundation Trust, with its main hospital full and A&E swarmed with patients. The Trust is responsible for Blackpool Victoria Hospital and two smaller community hospitals, Clifton Hospital and Fleetwood Hospital. The Trust's chief executive has confirmed that an internal critical incident has been declared. It is due to the hospital experiencing high demand and long waits in the emergency departments and urgent care pathways. Read more. COVID critical incident declared at Morecambe Bay hospitals as operations cancelled. The Vic is also running at full capacity, and more people are being admitted to hospital each day than are being discharged, which cannot be sustained as COVID infections continue to surge. High staff sickness absence levels are also impacting day-to-day operations, with more than 10% of employees off, as per a Tuesday morning, January 4th, memo seen by from Trust Chief Executive, Trish Armstrong-Child. This is the second Trust to declare a critical incident in Lancashire in as many days. University Hospitals of Morecambe Bay NHS Foundation Trust also declared a COVID-19 critical incident on Sunday afternoon. It has seen operations and appointments cancelled with staff redeployed to cover essential services. Image: James Maloney, a Lancslive. Full statement from Trish Armstrong-Child, Chief Executive of Blackpool Teaching Hospitals NHS Foundation Trust. I will ask colleagues from across the executive and senior leadership team to provide more details and specific updates, and asks throughout today, and indeed beyond, but I wanted to write first with an overview. You will be aware that the NHS nationally recently upgraded the response to COVID to a Level 4 incident. In addition, the Trust has now declared an internal critical incident. This is reflective of the operational challenges across the organisation, which include: we continue to experience high demand and long waits to be seen in our emergency department and urgent care pathways. Blackpool Victoria Hospital is running at full capacity, and we are escalated into both day case units, which means we are utilising all available beds. In addition, capacity at Clifton Community Hospital has been increased. We continue to struggle to discharge people who no longer meet the medical criteria to reside in hospital, and this is becoming more difficult with increasing outbreaks of COVID in the community. This has resulted in more people being admitted to hospital each day than we are discharging, which simply cannot be sustained as COVID infections continue to surge. This entire operating context is being exacerbated by high numbers of COVID-positive patients and those classed as contacts needing inpatient treatment. And lastly, but most importantly, the Trust itself is being impacted by high staff sickness absence levels of above 10%. I am aware of the long and protracted nature of our response to the pandemic, and thank everyone for everything being achieved, each and every day. I know colleagues are exhausted and the ask apparently relentless. Nevertheless, your help and focus in ensuring we continue to prioritize safe and effective care for all patients has never been needed more. I also want to ask you to continue to support each other during this extremely difficult time. I know colleagues across divisions will be working together today to ensure specific team priorities and actions are identified, agreed and actioned across all areas. This must include stepping down activity, which is not critical, as well as delivering all of the things we can and need to do to provide the very best care possible. We will be working across the Fylde coast with our partners too, not just on ensuring care packages and support is provided as quickly as possible, but to encourage people to take up their vaccinations and booster, as well as helping local people to make informed choices about alternative access to appropriate care. Please make sure you get your vaccine and booster, and if you haven't signed up to LAMP testing, please do that immediately and help us to prevent nosocomial infections too. These things are easy but utterly critical to our effective response. Genuinely, thank you for everything you are doing. It is appreciated, and know you are making an incredible difference every day to each other and our communities as a whole. If there is anything we are not doing that you think would help, please raise it. You can contact me, your line manager, or any one of your local team to make suggestions, and if it will help, we will do it. Download the LancsLive app for free on iPhone here and Android here. To keep updated, follow LancsLive on Facebook and at LiveLancs on Twitter. Have you got news for us? Contact our news desk on lancslive@reachbook.com. Get all the latest news, sport and what's on stories sent to your inbox daily with the LancsLive newsletter here.